Good morning, class. Good morning, Dr. D. I'm Akia. I'm making this video presentation in reference to my final. I hope that you all are able to see this video okay and that you all was able to turn in your final just fine. So, getting started with the presentation, I just want to let you know that this class was fantastic for me. I learned a lot from this class. A lot of the ethical and legal issues, some things I wasn't even aware about. So this class was very beneficial to me. The name of my final, I titled it as The Values of Life. So the question is what is life? What is it to live? What does it mean to be living? I can ask 100 different people the same question and get 100 different answers. In my personal opinion, to have life to live is just to be happy. Be happy with where you're at in your life, being content with just being who you are, live every day like it's your last. I'm a very happy person, so that is the meaning of life to me. We have so many different things that come into place while we're living, and so many things that we need to contemplate upon our death. Yes, I know. Death is not something that we want to talk much about, but it is a fact. And we have so many different opportunities right now to make our death just as valuable as our life. And I will give you a couple of examples about those later. But first, I want to explain to you a couple of the case studies that I wrote in my paper and that I had along the class. One of my case studies was about life support. Now, to me, life support is something that is a machinery, it's equipment that helps to assist with your breathing if you can't do so on your own. Now, with that being said, we have two cases, and it's ironic they came during the course of this class. I'm sure that you've either saw in the news somewhere or read in the local newspaper or heard about it through a colleague about the two life support cases of the 13-year-old Jahid McMath and the 33-year-old Marlise Munoz. Now, both cases are very similar. Both cases are women, and both are life support due to being brain dead. Now, the question that is in place is the families. While Jackie's family, the 13-year-old, wants to keep her on life support, the medical professionals don't. And then in the case of the 33-year-old, she's pregnant, so the family wants her off of life support. And the hospitals don't because they feel they have a legal obligation to the unborn fetus. Your question is, again, we talk about ethics and what's legal, what's right, what's wrong. This is where, things become a little bit uncomfortable, hard on a family. But in my opinion, I think that ultimately everything that's done should be done in the eyes of the patient, for the patient's purpose. You hate to lose someone, but it's a selfish gesture if they're going to be incompetent for the rest of their life and have to live off a machine. The reason why these two cases hit home for me, because I lost my grandfather while he was on life support, and he didn't have anything to back him up. And that is what leads me into this next topic. If he would have had the proper documents to back him up, the family wouldn't have went through so much turmoil, wouldn't have been so much arguments about whether or not he should stay on life support or not. Before any decision was made, he passed away while on life support, but it still caused a big issue. So with that being said, I know I mentioned about death and how we don't want to talk about it, but it is a fact. And we should value our death as well as our life. And I'm going to explain these different documents to you. And this should be able to help you to understand what I mean by that statement. So you have your power of attorney forms, different forms, plenty of different forms, that can help assist, give other people the legal authority over your health, give them, the right to make the decisions if you become incompetent. But why not have the proper paperwork in place while you're competent, just in case you do become incompetent, you are set. So that's where advance directive and a living will come in place. Both of these documents help the physician know where you stand, your family know where you stand. If you're looking at this video right now, I suggest you to read upon the living will, what it does for you. Read upon the advanced directory, and make it so that those are options that you can take advantage of right now, so you don't have to go through what the family of both these victims, both these patients per se, has gone through. Um, have these things in place. That is what they're there for. Utilize them, study and read about them. I've never wanted to have a will, but now I do. This class alone has helped me to want to have a will, because anything can happen. Um, in working in a medical field, we come across so many different cases where legal paperwork has a lot to do with it. And one, the case studies that I spoke of during the class and wrote in the paper, is about informed consent. Now, that informed consent is a paper that you use when you're in a competent state, but you're admitted in a hospital or being seen at any doctor's office for any reason. You sign this form giving them the okay, let them know, like, hey, okay, I have this procedure. It's okay for you to do this. It's okay for this to happen. And that is why you're completely competent, but it's still legal and it's still binding. Okay? So, with that being said, you know, even with the informed consent, you have patients who have their right to refuse certain treatments at the hospital, um, don't want certain medications and don't want certain procedures done, because they just don't want them. And there's nothing you can do as a healthcare professional but to honor their rights as a patient, and go about things the right way. Just to give you a brief example, I had a patient. I'm a radiology tech and I work in special procedures, and I had a patient who did not refuse to have a burying animal. She had Crohn's disease, and it was definitely a test that would benefit her. And if you work in the medical field and you're not aware of what a bee is, try looking it up. It's an uncomfortable exam for the patient, but we do it in the radiology department. Um, it's close to having a colonoscopy. Kind of the same thing. Kind of, if you have an incomplete colonoscopy, then you come to us and we do a barium enema just to see the flow of the intestinal tract. So just look that up. So furthermore, she refused to have it, and I had to honor her. I had respected her wishes, and that leads me to the different rights that the patients have. And the different obligations us as healthcare professionals should acknowledge, so to speak. So with that being said, I spoke of, we have all these different um, life sustaining equipment like the life support. You have the different documentations that help to assist with, you know, pretty much laying out how you want your death, if anything what's to happen to you, what treatments you want, what you don't want. Um, you have the different consents while you're competent to assist you if something was to happen to you. But what about the different options that is out there? Um, the big debate about postponing life or stopping life altogether, such as abortions. You see that all the time, that's been a big debate between the pro-choice activists and the pro-life activists. And we can argue all day that having an abortion is another source of killing an unborn child. Um, but again, I personally feel that no legal society system should be able to make that decision for a woman. I think that certain cases do, you know, uh, need the source of having abortion.